Okay, so this is my patient Tori. I already gave an intraoral examination on Tori, but now I'm just going to see what her concerns are when it comes to her dental hygiene. So what concerns do you have with your mouth, Tori?
I have bad breath, some sensitivity, and I have a lingual retainer that I'm having trouble flossing, and I've noticed bleeding.
Okay. Okay. So I just want to ask you, and with your routine, just to kind of get a better idea, to kind of go along with your intraoral examination. So how many times a day do you brush?
I brush 3 times a day due to the bad breath.
Okay. And how long do you usually brush for?
Like a minute.
Okay. And is it a minute for each time usually? That's the maximum you'll do?
Yeah.
Okay. And what type of toothbrush do you use? And when I'm saying the type of toothbrush, what type of bristles? There's soft, medium, hard?
Medium.
And it's a manual?
Yes.
Okay. And you're flossing everywhere else, but it's that interproximal that you're having the issue?
Yes.
Okay. So, are you right-handed or left-handed?
I am right-handed.
Okay, and there's a reason why I'm asking this. Can I have you show me how you brush your teeth?
Sure.
Now think to when you're brushing if you can. I know it's something you do every day, so it's kind of hard to remember. We kind of zone out. Do you usually always go to the left side?
Yes.
Okay. So now the reason that I'm asking that is because when I did your intraoral exam, I noticed some recession in that area. And what that means is just a little bit of bone loss. So I think that's where your sensitivity is coming. Is that usually
Yes.
where you're feeling it? Okay. So we're going to talk about how to take care of that with some toothbrush methods. So because this area has some recession, we got to be a little more careful in that area. So what I'm going to have you do, it's called the Stillman's method. So I'm going to have you place it a little more on the gum at a 45-degree angle, just like this. And you're going to brush and swish. Brush and swish, okay? Brush and swish. You just kind of want to massage those gums and treat them, like bring them down a little bit, all right?
Okay.
Now the rest of the area of your mouth, gum-wise, it's pretty healthy other than down here. I'm noticing some mild gingivitis, but we'll get into that. What I want you to do for this is the Bass method. So it's 45-degree angle, right at basically where your gum meets your crown. And you're going to do the same thing. Brush, swish. Brush, swish. Now for the insides, 45. You can go like that. If you can fit, on here it's a little bigger so we're able to fit this way. Down towards the gum and up. Okay? So I want you to do that, and I think it will help especially in that recession area.
Okay.
What I think is happening is you're scrub brushing. So you're focusing so much on this area that it basically what it does is your gum almost gets eaten away, if you want to think about it that way. Not that anything's eating it, but the bristles. And also with a toothbrush, I want you to use soft, okay?
Okay.
Anything harder than soft is no good for your gums. And you're saying that you're using a medium, so again, I don't think it's helping in that area. So we'll do that. Now, for toothpaste, what I want you to use, because you're saying you have that sensitivity, I want to focus with the toothpaste to help that. So I want you to use Sensodyne. And I'm going to, if you can't find Sensodyne, there's ingredients I want you to look for.
Oh, okay.
So I'm going to have you turn to the active ingredients. And what I want you to look for is either potassium nitrate or stannous fluoride. Both of those help with anti-hypersensitivity. It's going to help with that sensitivity in that area, okay? This one with the potassium nitrate is just anti-sensitivity. The stannous fluoride does help with anti-cavity and anti-gingivitis, so that also is good. Now, so for your mouthwash, I want you to use ACT. The reason why I'm going to have you use ACT is because it's anti-caries. The anti-caries is going to help in the area where you have the recession. Why I want you to do that is because I want to be proactive in that area. Because where you have the recession, that's where the enamel ends, and now we're into dentin, okay? And you're cementing. So it's a little more prone to cavities in that area, so I just want to be proactive, and we're already helping with the sensitivity with your toothpaste. So at least with this mouthwash, we can be proactive and to make sure that you get no cavities in those areas, okay?
Okay.
And now what I also want to go over is the tongue brushing. So with the tongue brushing, what I'm going to have you do is I want you to go forward on your tongue, just like this. You always pick it up and go back. Pick it up and go back. You don't want to go backwards because you're going to hurt the taste buds, the papillae that are on your tongue, and we don't want to do that. Also, I have a tongue brusher, which I'm going to show you how to use, and it's going to be the same thing. You're just going to glide, so I'll show you how to do that, but again, you're just going to glide. So the reason why I'm going to have you do both or either or of those methods is because I think the bad breath is coming from your tongue. Bacteria can sit on your tongue, and again, just like you can have biofilm on your teeth, you can have biofilm on your tongue. So if we're not disrupting that, it's going to cause it to eventually smell. Okay, so I'm going to have you do that while you're brushing your teeth, and then of course you can always do your mouthwash after.
Okay.
And then for your lingual bar, because I'm noticing some of the mild gingivitis, and you're saying that you are bleeding, and when I looked, and if I poke in that area, it does bleed right away, I have interproximal brushes, okay? So I'm just going to show you those,
Okay.
along with that tongue brusher, and I'm going to show you, and then you're going to show me how to do it. So I'm going to show you two types of brushes, okay? So we have one that is a little thicker. Of course, it does get smaller. It's basically whatever you would like, okay? So you would just put it in between your teeth, like this, and you just pull out. Okay? And then I'm going to show you that I also want you to floss on top of the teeth, okay? Because it's a little tighter in there, these aren't going to get there. You don't really have too much spacing. So I'm going to have you floss on top, so you're disrupting that biofilm, not only underneath the bar, but on top of the bar.
Okay.
And the reason why I think there is bleeding is because we're not disrupting that biofilm. So that biofilm is basically just bacteria that sits on your teeth after you eat, especially if you eat sugar, you realize you have a film on top of your teeth. We're not able to disrupt it down there because you couldn't floss, okay? So we're going to disrupt that, and then hopefully that swelling and the bleeding will go down. That, and then I'm going to have you hold the mirror, okay? I'm going to give you the interproximal brushes first, okay? So I just want you to go in between your teeth and just show me how you would do it, just so we make sure that everything is correct. Perfect. Awesome. And you can do that before you brush, after you brush, even during the day if you would just like to do it. If you can't get your hands on a toothbrush, you just always make sure that that's clean underneath.
Okay.
So now, I just want to show you, let me have you just stick out your tongue, that you would just go forward like this, okay? It is just a tongue scraper. So I'll just have you show me how you do it. Okay, perfect. And then I'm just going to show you the floss on top. I want you to wrap it around your middle finger. Okay. And what you're supposed to be doing is every time you floss a tooth, you move the floss over, okay? You don't want to kind of use it on the same tooth. They say that you could spread bacteria. You will just go a soft C. I want you to hug the tooth, okay? And up and down, and then you would hug the other side of the tooth, okay? So I'll have you show me. I will get you a piece of floss. And again, I do want you to get the soft brush, okay? And I will have you go home with all the products that I have so that you know for the future what you need to get. So we will switch, and let me just see the soft C. Awesome.